I want to acknowledge that we're joining today from the traditional territories of the Lekwungen-speaking peoples, and I'm very grateful to the Songhees and Esquimalt nations for their stewardship of these lands since time immemorial. So yesterday evening, I can confirm that the 4 Canadians who had remained aboard the MV Hondius at the time the WHO recognized that this was an outbreak of hantavirus, they arrived safely at Victoria International Airport last night. Their arrival went very smoothly, and I'm very grateful for all of the support that we had, and they are all now isolating in the Island Health region. I want to express my appreciation for the teams from the Public Health Agency of Canada, from the Quarantine Service, the Canadian Armed Forces, and of course our very strong Island Health teams for making it seamless and smooth. I will say that I was reticent to say that they were due to, or the plan was for them to come into Victoria yesterday when we talked. The flight was still en route, as we know, to Quebec, to Bagotville, and we had a number of contingency plans along the route, just in case something happened. So I'm very grateful nothing did, and it all went very smoothly last evening. On arrival, each individual was screened and thoroughly assessed by the Island Health public health teams, and we were there in a very controlled conditions, wearing appropriate PPE. All 4 were and continue to be well and have no symptoms. This is reassuring, but as we talked about yesterday, we are in a very critical phase of the incubation period. And in keeping with the established protocols that we're following here and around the world, the people who arrived here yesterday were transferred directly from the airport to the secure pre-arranged lodgings where they have begun a minimum of 21-day period of isolation, under direction and with ongoing contact of our Island Health public health team. And I'll get back to why I stress minimum in a minute. After talking to each of the individuals, I can confirm that 2 are a couple in their 70s who live in Yukon Territory. 1 is a person in their 70s who resides here in the Island Health region, and 1 is a person in their 50s from British Columbia who is currently living abroad. We are working closely, as you can imagine, with the Yukon, where the concern was that they do not have the capacity to test or the facilities to care for somebody should they develop the severe symptoms that we're seeing have been associated with this hantavirus outbreak. During this time, each of these individuals will be receiving daily monitoring by our public health teams, including regular symptom checks, wellness assessments, and clear guidance on what to do should their health status change. And again, these Canadians have been through a very difficult number of weeks, and it showed last night. They were tired and I would say exhausted, but very relieved and grateful to be back here in Canada. I want to provide assurance as well that at no point during their arrival or transfer did any of them come in contact with the public, and the healthcare workers that were involved were all wearing appropriate PPE at all times. We now have daily monitoring in place, and they will remain fully isolated for the duration of their monitoring period. In understanding what happened on board that cruise ship in discussions, none of the Canadians had known direct contact with ill people on board that ship. Having said that, in a closed environment like a cruise ship, it's very difficult to know for certain. We do know that the European Centre for Disease Control had people on board the cruise ship who did an assessment of all passengers who were on board, and we consider globally that all of the people who are on board that cruise ship are what we call higher risk contacts. But within that context, the 4 Canadians were in the lower risk spectrum in terms of where their location of their cabins were and the types of activities that happened on board that cruise ship. So that is, again, something that is reassuring, but doesn't rule out entirely that somebody may have been exposed and may be incubating. As I said, these people are right now not showing any symptoms. They're in appropriate isolation and monitoring measures in place, and we will assure that the situation will be managed carefully every step of the way. We've all seen the news, and we've had some ongoing calls with our colleagues at the Public Health Agency and globally about some of the other passengers developing symptoms and developing testing positive. And particularly, it's very concerning and tragic about a person who returned to France and has tested positive and is quite ill. We are all hoping that the 4 people who are here with us will remain well through this incubation period, but this is exactly why we are taking the precautions and why plans are in place should their conditions change. We have been discussing across the country as well as globally about testing and what type of testing might be helpful or might not. This is a challenge because there's very little known about how tests can be helpful or not in the management of hantavirus, and particularly the Andes strain of hantavirus. We know that there's little benefit for some tests in people who are not showing any symptoms, but we're going to reassess that as we see what happens globally. We do have the ability to do appropriate testing for hantavirus, including for this strain of hantavirus here in BC, and we will be monitoring and checking with our colleagues globally about when and what types of tests might be helpful. Should any of the 4 people who are here with us develop symptoms, we have established protocols in place to ensure they can be properly and safely assessed, tested, and cared for without risk to the public and with all the appropriate precautions for healthcare workers in the healthcare setting. So this includes safe medical transport. We have protocols with the BC EMS, strict infection prevention and control measures in all of the health facilities. We have the ability to do the diagnostic testing here in British Columbia through the BC CDC, and of course, access to specialized clinical care should it be needed. So my office, the BC Centre for Disease Control, Island Health, and federal partners, including the Public Health Agency of Canada, Global Affairs Canada, and others, continue to work closely together to coordinate monitoring, to understand what's happening with the other people who were on that cruise ship globally, and there's a strong community who's sharing all the information that we can, and to coordinate assessment and care if needed. And I do want to again stress how grateful I am for the teams at Island Health. Dr. Reka Gustafson is the Chief Medical Officer, and her team were fantastic last night, and I know that these people are in good hands and will be followed up rigorously. I also want to mention, that it reminds us again of the importance of the WHO in coordinating this type of global outbreak, the implications of an outbreak that have global implications. And I'm, just knowing the challenges that the WHO has been facing, I want to remind people how important it is to have that expertise at the global level to support all of us in sharing information and being able to determine the best possible ways of action. I did mention that we have said a minimum of 21 days, and we've also been thinking about, when does that clock start? And prior yesterday, I had said the clock we thought would start on the 6th of May when the last known case was taken off the cruise ship. We've re-looking at that in the face of what we're seeing, particularly with the case who developed symptoms quite quickly in France. And so we are agreed, and we've been talking to the 4 people who are here, that the clock will start yesterday when they arrived here in Canada. And there has been concerns about 21 days versus 42 versus 45. So the known incubation period is about 6 weeks. So that's 42 days. And I can reassure you that these individuals, the 4 people who are here now, will be followed daily for the 42 days of the risk period. What we're talking about when I say a minimum of 21 days, that's that complete isolation with no contact with anybody, making sure that they are safely able to manage. But that's the highest risk period for somebody to develop symptoms. And that is the minimum that we're going to. As we see the situation evolve globally and here, that might be extended. It might be extended as far as the full 42 days. But as you can imagine, that's quite a burden on people, and it's challenging to stay in one place for that period of time, especially as the risk diminishes over time. So we'll be reassessing that on an ongoing basis, depending on how people are feeling, depending on whether anybody develops symptoms, and depending on what's happening globally. So I think we are all aligned globally in that all of these individuals will need monitoring at least daily, and plans in place to support them for the full 42 days. I know this news, again, can be unsettling to people in British Columbia, and certainly I also have felt unsettled as we've been watching what's been happening in the last few weeks, especially in the light, of course, of all that we went through due to the COVID-19 pandemic. But I want to, again, reassure everybody that hantavirus is a very different disease, and it's not spread in the same way that we saw with the coronavirus, with influenza, measles, and other diseases. So we are seeing this in the limited spread so far. This is a virus that we know. We have had cases here in British Columbia. They're rare, and that's why we're learning about the transmission, particularly person-to-person transmission, which is even more rare. It's not highly transmissible, and we know that too. And it's not what we would consider a disease of pandemic potential. It is, however, a very serious illness. So I think of it as a serious and important disease that we need to understand, and we need to understand the risk to these individuals. But it's limited in terms of we don't expect to see transmission now that people are safely in isolation and being monitored to people outside of those who were exposed on that cruise ship. If there is a change in the condition of the 4 people that we're monitoring here in BC, we will provide further updates as soon as we know. Our priority, and my priority, continues to be to support the health of these 4 people who are now home while maintaining our strong safeguards for the people of British Columbia. And I want people to be reassured and confident that this response is guided by established public health planning. Our teams have had a lot of experience on case monitoring, managing people, knowing how to support them through these very difficult times, on evidence-based measures that are continuing to evolve, and we will continue in close coordination with our colleagues across the country and globally. And these measures will be applied steadily and carefully as we go through this next few weeks. Thank you very much. I'm happy to take questions.
Thank you. A reminder to reporters on the line, if you'd like to ask a question, please make sure you are not on speakerphone or mute, and press star 1 to enter the queue. Reporters will be limited to 1 question and 1 follow-up. We'll start here in the room with Keith Baldry, Global News.
Thanks, Dr. Henry. Just to your last point about this not being like COVID, many people watching this no doubt are going to have flashbacks. You being in this room at that podium against those flags, more than 250 briefings here by you on COVID. Can you again articulate and explain the fundamental differences between what we're experiencing now and what the coronavirus was?
Happy to do that. I will note it is a different podium. So which makes me feel a little better too. Coronavirus, the SARS-CoV-2 virus, is one that causes infection in the upper respiratory system first. And so people shed quite a lot of the virus in their secretions when they talk or sneeze or cough, sing, and it's spread through the air. And we know that especially the Omicron strain of the coronavirus, it can last in the air for some time and spread quite rapidly to people, especially in closed environments with poor ventilation. So when we think of coronavirus and we think of the cruise ship that happened in 2020, that virus spread very quickly through the ship. People were affected even if they hadn't been in contact with somebody because it likely spread through the ventilation system and other areas. We're not seeing that pattern of spread with this very serious illness. What we're seeing is people getting very seriously ill, and those who provided care to them, those who lived with them, those were their partners who had that strong, close contact over a period of time, were the people who seem to be getting infected now. So that's very different. It's a very different scenario when I look at it from my perspective, knowing how these outbreaks evolve over time. We don't see the same pattern of spread that we would see if it was transmissible in the same way as coronavirus or measles or influenza. The other one that we see quite commonly spread very rapidly in cruise ships is norovirus, which can cause vomiting and diarrhea. And that can spread very quickly and affect people. So that's a completely different pattern than what we're seeing happen and emerge now. And so far, there's nothing that makes me concerned that that's going to change. So now that all of the individuals have been taken back to their countries and the 4 Canadians who are here, we know who has been in contact with whom, we know how to manage them, how to make sure that if they develop any symptoms at all, that they won't be in contact with anybody other than healthcare professionals who are wearing PPE and can do it in a safe way. So I think that reassures me that we're dealing with a very different thing right now.
I'm sure most people up until now had never heard of hantavirus. Do we have enough scientific data and experience with this virus to make a number of conclusions, as we did with the coronavirus?
Yeah, we probably know more about hantavirus than we did about the coronavirus prior to the pandemic. So hantavirus is something that has been in Canada, globally. There's European strains, there's strains in South American strains. I believe our first case was in the early 90s here in the Canadian case here in British Columbia, actually, acquired in a different part of the country. So we do know about hantavirus. It's a rare disease in that it doesn't happen very commonly, but we do have a good test for it. We do know how it spreads. So the sin nombre strain of the virus that we see here in North America has not been known to spread from person to person. Never say never, but it has not been known. We do know that it's spread by rodent droppings, rodent urine, saliva that dries and then can be aerosolized when we do things like cleaning out the cottage before opening it up for the summer. So every year around this time, public health, we would put out messages to remind people of the safe way to clean up those dusty places where there might be rodents and rodent droppings. And so I would refer people to the BC CDC website, to HealthLink, and there's lots of detailed information on how to protect yourself from that. We know in Chile, in Argentina, they've been dealing with this Andes strain of the hantavirus for a number of years as well. And there is some data, it is limited, but there's been published reports about clusters of people who've had close contact where it's been transmitted from one person to another person. So that's why it's within the realm of possibility for this strain of virus. And that's what we're seeing play out. I think there's global consensus now that it was very likely that the first case or cases, the 2 of them, may have been exposed in an area where this strain of the virus is known to be to exist, where we know where Argentina has reported a dramatic increase in numbers of people with the disease, over 100 in the last little while. So it's likely that that's where these people picked it up. And then because it has such a long incubation period, they develop symptoms on board the cruise ship. So we do know quite a bit. I think it's really useful to know we were able to do, globally they're able to do whole genome sequencing, and that's way we could tell that it was the Andes strain, not the Sonoma strain. It hasn't changed a whole lot, so that's something that is quite different, that's important. That tells us that it's not, the virus isn't mutating and causing different sources becoming more infectious or anything like that. So that's also reassuring. Unlike the coronavirus, as we remember, SARS-CoV-2, it changed quite a lot, very rapidly over time. So those are two things that we know a lot more about, and we're going to learn a lot more with these 160 some people who have been exposed over the next few weeks and months.
Our next question comes from Katie DeRosa, CBC.
Dr. Henry, when you talked about the individuals isolating at an island health location without, I'm sure you can't say the address, but is it a hospital facility or a clinic, and they're all being held together? I guess, can you give us an idea of where this monitoring and where this isolation is happening?
Yes, it's not in a healthcare facility. It's not in a secure facility. They're being monitored in appropriate places separately. So one person lives in this region and they will be monitored at home. They live on their own, which makes it easier and more comfortable for them. The other two are in facilities that Island Health has procured, and that will be monitoring over the next number of weeks, as we know. But the couple are from the Yukon are together, and the other individual is on their own.
The difference in terms of the pandemic, is there an overcorrection because of how quickly the pandemic, the coronavirus spread, and that it was too late? Is there a over cautiousness with this, or the right amount of cautiousness? How would you assess how this is being handled both here and globally?
I don't know if we can be overcautious given the trauma that we've all been through, but I think it is appropriate. It's appropriate that because it's such a severe illness, that's the thing that worries me. It's rare, but we've now seen 8 people, now 9, if you include the person from France, who have tested positive. 3 people have died. That's a very high case fatality rate. They've become quite ill very quickly. We now have 1 person still in hospital in South Africa, 2 people in hospital in the Netherlands, 1 in Switzerland, 1 in France right now, and a probable case you may have heard of in Tristan da Cunha, which is a remote island. So the impact of it, even though the risk is relatively low, and certainly the risk to anybody outside of those who are on that cruise ship or on one of the flights is infinitesimally low, and we want to keep it that way. But the risk to those individuals is quite high, and because they come from many countries around the world, that means we really needed a strong coordinated response to make sure we weren't exposing anybody else to potential of being exposed to this very serious virus. So as I say, it's serious, but limited. So I think the coordination and the approach that we've had is proportionate to the seriousness of the disease.
Our next question comes from Rob Buffum, CTV News.
Oh, hi, Dr. Henry. Nice to see you, maybe not in this setting, but I just wanted to understand, is the operating theory that everybody who got, that the hantavirus in this instance that spread through the cruise ship to a certain extent originated with 2 people who got it in Argentina, and then they spread it through human contact? My basic understanding is that hantavirus typically comes from rat feces, but that's not how everybody here got it. They got it from other people. Is that correct?
correct. And that's the global hypothesis that makes the most sense given the investigations. I know many people were thinking, oh, rats on board a cruise ship, but it has been thoroughly inspected and there was no evidence of rodents on board the cruise ship. So that gives us some pieces of information. And if we look at when the initial case, so a gentleman from the Netherlands became ill, it's consistent with an exposure before they joined the cruise ship. And they were known to have gone on into a more remote area where this virus does exist in rats and other rodents. And so it is very likely, I think the global hypothesis is that the infection, the exposure to the rat feces or whatever in the dry area that they were in happened before they arrived on the cruise ship. And that means that it's hard to say because it was a couple from the Netherlands and they both became ill, whether they both had the initial exposure or whether the wife was exposed to her husband once he became ill. But yes, the other people on the cruise ship had direct exposure over a prolonged period, in the most part, with those two individuals when they were sick. So that's important.
In the spirit of these pressers, I'm going to try and do a double-barreled question. Just wanted to be clear for myself anyways, how many Canadians currently are impacted by this? I thought I saw something this morning talking about 3 people in Ontario. Is it 3 or 4 in BC? I guess I'm trying to, if you know what the total number of Canadians who are on the cruise ship or who are isolating. And also I'm just curious, Keith asked you a question, Katie did as well, about dividing this, or separating this from COVID, but you must be feeling some almost, I don't know if it's PTSD, but it must be a strange feeling for you. I'm curious to get inside your perspective as you've spoken to other global experts as you try and address what is a very worrisome situation.
Yeah, well, let me address the first one. What we know, as of now, there are 6 people who are back in Canada who were on board that cruise ship. So 4 who are now here in British Columbia, 2 in Ontario. There were 2 other events where people were potentially exposed. One of them was the flight from St. Helena to South Africa, to Johannesburg, where the wife of the initial case was on board that flight and was starting to show symptoms. When that flight landed in South Africa, they were boarding a flight from Johannesburg to Amsterdam. And so the wife was notably quite ill and was on that flight for a period of less than an hour. They were medically assessed. The flight was delayed, didn't take off, and they were taken off the flight and taken to hospital and died the next day in South Africa. So incredibly tragic. There are people who in Canada who are on the flight from St. Helena to Johannesburg, and they are being monitored. They're in Ontario, 1 in Quebec. And there are people who are on the flight from Johannesburg to Amsterdam who were within a very close proximity to the individual who was sick for the short period of time that they were on board that flight, board that airplane. And they are also being monitored in Alberta and Ontario.
Next question comes from Wolfgang Deppner. Whoops, sorry.
One other group of people that we don't consider to be at risk, and that's people who were, the other people who were on that flight from Johannesburg to Amsterdam, who were not in the close proximity of where this individual was sitting. So KLM, I understand, has sent letters to those people. We will follow up with them and make sure that they know what to do should they develop symptoms or if they have any questions. I think I've talked before about how I was very concerned in late 2019 about what I was hearing about infections that were happening in China, and our global community of people who follow these things. We were all quite anxious about that. And sadly, it did turn out to be the tremendous impact it had on all of us and people around the world. And yes, I probably have as much traumatic stress from that as anybody else in this province, in this country. When I first heard about what was happening on board this cruise ship, I did have a bit of a sinking feeling. But once it was identified as hantavirus, and once we were very confident that what was causing it, at first, I was a little incredulous because I hadn't heard much about the strain that could pass from person to person. But again, globally with the infectious disease specialist, with public health and ID colleagues around the globe, we all have a very similar approach to this, and we calmed each other down. So it is, very different, important, serious, and we need to take all those measures to make sure there's no opportunity for others to be exposed to this very, very unfortunate and tragic situation. So that's where I am now. I'm behind this podium, but there you go.
Thank you. Next question is from Wolfgang Deppner, Canadian Press.
Yeah, good morning, Dr. Henry. Thank you for taking my question. Earlier, you mentioned that health officials are assessing whether there should be testing for hantavirus. What would that testing look like? We're looking at 5 million people in this province alone. And how can you be sure, or how can health officials be sure that this testing will indeed be successful? Because one of the individuals in the US that has tested positive was also asymptomatic beforehand. So I was hoping that you could sort of clarify that.
I'm not talking about testing of people in the province. What we're talking about is the individuals who were exposed. So the 4 people, 2 in Ontario, 4 people here. We do have a plan. If any of them develop any symptoms that could be this, even as much as a headache, then we have testing available and a protocol to be able to do that. But globally, there's some looking at, what can we learn and can it help us in managing people? So there's 2 types of tests that happen. Both of them are done on blood. So it would be taking a blood sample. One of them is looking for antibodies in the blood that happen after somebody's been infected. So we do what's called a before and after sample. It takes time for your body to develop those antibodies, several weeks. So it would be taking a blood sample now and then testing again perhaps at the end of 42 days. And that will give us a sense if anybody developed antibodies without showing any symptoms. So those are one of the big unknowns. So that's something we're talking about. Is that worth doing? Does that help us in any way? The second test is what we call a PCR test. So it's able to detect the virus itself. It can't tell if the virus is live or dead, but it can detect the RNA or the DNA in the virus. And that is also done on a blood sample. So it looks for what we call viremia, virus in the blood. And that was the one that's a little more fraught. For example, my understanding, and it's yet to be confirmed from the US, is that the testing was equivocal, that there was a positive and a negative and a weak positive, and the person is asymptomatic, and so there's unclear what that actually means. So that's another one that we're wrestling with. If we do these tests, if it's negative, it doesn't tell you anything. It tells you that they don't have the virus in the blood at this minute. But if it's positive, how do we know whether it's truly positive or whether... So it just, those are questions that we're wrestling with in the lab community globally. So trying to understand it better.
Thank you for that answer. Earlier, you gave a little nod to the Canadian Armed Forces, and you also said that Island Health has secured facilities for these two individuals to isolate there. Just putting one and one together here, are we to understand that these individuals are isolating on one of the Canadian Armed Forces bases that are on the island? Thank you.
Actually, no. My nod to the Canadian Armed Forces was specifically to 443 Squadron out at the airport, who were very helpful, opened the facility so that we had a secure, safe place to safely assess and monitor the 4 individuals when they arrived last night. So once again, 443 Squadron was fantastic. They were very supportive and helped us do it in a way that was safe and that nobody was exposed.
Our next question's from Mackenzie Reed, Check News.
Hi, thank you so much for coming and speaking to us again today. Wondering why bring them to Vancouver Island and to isolate here, especially when yesterday you had talked about the Biocontainment Center in Surrey Memorial Hospital. So why not isolate them closer to that facility rather than having them on the island?
Yeah, we talked a lot about that, whether they should go to a closed facility somewhere in another part of the country. As I mentioned, 2 of them have strong connections to British Columbia, including one person who's able to isolate at home, which makes a big difference in somebody's life. And the couple from the Yukon, we have a very strong relationship with Yukon. We do the testing for them. People with very serious illnesses like this often receive treatment here in British Columbia. So it made sense for them to come here. The discussion about Lower Mainland versus here, we just felt we had the capacity and the ability to better manage them in a safer way. Here, we have strong protocols should somebody become ill to be able to test them and care for them here. If they become seriously ill and there's any concerns, we have a protocol to be able to take them through BC Ambulance to BC Emergency Medical Services to Surrey Memorial should it be needed. So they're just on standby. But Surrey, as you know, is a very busy hospital. We don't want to take up extra space if we don't need to. And it was logistically worked better to have people here.
And for those people who are isolating together, what are some of those protocols to ensure that if one develops symptoms that they're not then giving it to the other person that they are isolating with? What is some of that risk and what are some of those concerns around that as well?
Yeah, so this is a couple, and they were together on the cruise ship. They were isolating together on the cruise ship. There makes no sense at this point in time to separate them, especially for the length of time that we're talking about. So they are considered as a unit. Should one of them become ill, clearly that means the risk for the other is much higher and that we would need to assess and manage that as well. But we did this in consultation with them, and they are very comfortable being together. And really, if you think about 42 days, 6 weeks away from your partner, there's not much logic to that, given that they've been together for the last number of weeks anyway.